Hi guys, my name is KP Balan. As some of you guys know me from my previous video, I'm an ED registrar and I'm also in the training program to become a GP. Today we have a special guest. This is Anika, my daughter. I thought why not introduce her in this video as she plays a big role in my life, right? All right. So today I'm going to be talking about becoming a GP. I thought, well, I'm in the training. Why not talk about what I have faced, what I know, and my journey throughout this entire period while I'm in the training program? All right. So today, before we start, we need to know who is a GP. So first and foremost, who is a GP? They're basically community-based doctors that deal with patients with minor complaints and also chronic illnesses. And they're also the point of contact that refer on to specialists and for ED for serious conditions. As RCGP defines them, they play a central role in delivering the healthcare to the Australian community. So it is a big responsibility to know what is serious and what is not serious, and the entire training program is a very intensive course. All right. So how do you get started? So the schools that are available to get started is the RACGP, which is kind of highlighted in red and in bold because that's the college that I'm affiliated with, and that's what we're going to be talking about today. Then you have ACROM, and if you guys are interested in ACROM, again, you guys can hit me up with that, and I can give you details regarding the program, and also the RVTES as well, which is a remote vocational training scheme. But today, what we're going to talk about is more mainly on RACGP because that's what I'm doing at the moment. All right. So, eligibility and the process. Now, this is where it gets a bit tricky for you guys. You must have an Australian citizenship or a PR if you're thinking of becoming a GP, all right? And the RACGP has put a really beautiful flow chart on the eligibility for 2022. I'm going to post this up in my group, and so you guys can refer it to when you guys are applying for the program. You must have a general registration, and for international medical graduates, we have a thing called a 10-year moratorium. Now, I'll be going into this a bit detailed, but if you get an exemption, which is a 19AB form, if you fill it out and give it to the RACGP, and if you get an exemption, then you're exempt from the 10-year moratorium, all right? Once you're eligible and you have satisfied all the criteria, you give the AGPT CAAKT MCQ exam. Once you've done that, it'll be followed by an interview. And if you pass both stages, you're in the fellowship program, all right? So we'll talk a bit more about the 10-year moratorium because it is a bit tricky and it has to do with Medicare benefits and all of that. Now, so let's see. What is the 10-year moratorium? Okay, so 10-year moratorium, what it means is basically for the 10 years, you have to work in a region that is classified above MM2. You can find this information in the regional calculator on the RACGP website. All right. Now, when does it begin? So it begins the minute you are doing you've got your provisional registration, and for those who have done doing your WBA, it's when you get your limited registration, and all those years that you spend in the hospital are counted towards the 10-year moratorium. All right. So, for example, I have completed excuse her for that. She's just excited. I have completed about. I got my provisional registration about 3 years back, and then I've done 2 years of a hospital. So therefore, all those 3 years are counted towards my 10-year moratorium. So it's technically I have 7 years left. All right. So that's pretty neat. I mean, I'm reducing the 10-year moratorium, and I still get to become a GP. All right, and eventually work in the metro region that I want to. Then you have another thing called the DPA region, and DPA is for vocational registrar. So what that means is a fellow, a person who's completed their GP training, are known as vocational registrars and still have years left in the 10-year moratorium left over. They can apply to GP clinics that have a DPA classification and work in these metro regions. All right. So that's a bit tricky. And why do you have to work in these regions? It's because then you can claim the Medicare benefits. That is the only reason. So, and which is a big reason as well. Okay. The only other note that I would also like to make in this 10-year moratorium is that the further you go in the in the classification, so if you go to say MM7, 1 year is equivalent to 3 to 4 years. So that means if you do 1 year of GP training there, it deducts 3 to 4 years out of the 10-year moratorium. So that is a good incentive for you guys to go even further from the metro region. And all these regions are classified, and you can find out what these regions are on the calculator, on the regional calculator. All right. So moving forward, we're going to talk about the duration of the fellowship. So duration of the fellowship for the ACRM is 12 months for the core training, and followed by 24 months of the GP training, and then advanced for 12 months. Now the advanced is optional. All right. It is completely up to you if you'd like to take the advanced training. For the FRC GP, the same thing. So I'm currently doing the 12 months of hospital training time, and then I'll be doing my GP rotations, GP term 1, 2, and 3 in a regional area in 2023, and then followed by an advanced training. Now, ideally, the RACGP like you to complete the extended skills and the advanced training in the while you're in the hospital training time, so that you're not going back and forth between the hospital and the GP. So finish all your GP if you want to do the advanced training. Finish extended skills, the advanced training, the hospital rotations all together, and finish, and which would be part of your 10-year moratorium, and then go to your GP clinic, which would be helpful for you guys. Again, and if you want to find out about ACRM, just hit me up and I can give you further details on that later. All right. So we're going to talk about extended skills, which is 6-month duration, and advanced skills next. So if you guys are interested in advanced training, we'll get to that. But before that, every GP fellow should do an extended skills. And as you can see, there's a list of extended skills that you can choose to do for the 6 months. And it's according to what you're interested in and what you want to kind of specialize in while you're at the GP clinic as well. All right. And they're carried out in the hospital. Advanced training is usually for 12 months. And as you can see, the list is a bit smaller. I'm planning to do the advanced training. So I'm planning to do it in emergency medicine and thinking of doing a diploma. So therefore it can I can do acute care medicine when I go to GP clinics. So, or work as a registrar in ED if an opportunity presents. So these are the advantages of doing an advanced training. If there's a job out there, you can take the job because you've done a certification in that specific field, and you can work as a registrar part-time and part-time GP if you're interested in that. All right. So next, what we're going to talk about is the FAQs. Now, other questions that you guys might have. So 10-year moratorium. Can I work in a hospital in a metro region in the meantime? So for example, if you have completed your GP training and you've become a fellow, but you still have a couple years left in your 10-year moratorium, can you work in a hospital in a metro region? Yes, absolutely. And it will be counted towards your 10-year moratorium. And unless you want to keep working a GP practice, you can still work in a metro region as long as they have a DPA accreditation. All right. The other question that I get often asked is there a possibility to reduce the duration of training? Yes, absolutely. So it's called recognition of prior learning. So to get the recognition of prior learning, you must complete 12 months of hospital rotation with the general registration and must complete rotations mandated by the college. All right. So usually they include general medicine, surgery, pediatrics, and emergency medicine. So if you've completed all those rotations and if you've submitted the required forms, they will consider you for reducing the number of months for your training program. All right. So these are some of the common questions I've been hit with, and I thought I would address it in this video. If you have any further questions, don't hesitate to contact me. You can reach me through my Facebook group, KP Balan group, and my Facebook account, KP Balan as well. I have an Instagram page where I do post my videos and some guidelines occasionally. So do check me out on my Instagram page as well, AIMG_KP_Balan, and my LinkedIn at KP Balan. Krishna Priya Balnarayanan. All right. If you have any further questions, don't hesitate to ask. We'll see you later. Bye.